Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in beautiful Southwest Florida. Boy, we all know the importance of high blood pressure because high blood pressure is the silent killer of the heart. So all around the world, it's common that people will get their blood pressure checked because high blood pressure, a lot of times it doesn't cause any symptoms. So all of us don't want to have high blood pressure and not know it, because high blood pressure, you can do something about it. And we're seeing an epidemic of young people or people who are into health who are now having high blood pressure, and there doesn't seem to be a reason for it. We all know that if somebody eats really poorly and has a lot of extra weight and maybe they have diabetes, that those things can lead to high blood pressure. Well, in that instance, then getting on a proper diet, losing a bunch of weight, like one of our pastors at the church I go to came here with high blood pressure, and then I asked him a few questions, and it was clear that his diet wasn't what it needed to be. So he's cleaned up his diet, and his blood pressure now is completely normal. But for the person who has high blood pressure and they've done diet, they have a relatively peaceful lifestyle, there may be a structural cause of the high blood pressure, and that's what we're going to talk about today. If one studies high blood pressure, about 90% of cases are called essential. Essential means there's no known cause that's obvious for the high blood pressure. So to me, that means we don't know the cause. So this video is about, well, maybe a good portion of these people actually have structural high blood pressure that's coming from a breakdown of their cervical curve. In this article, it's noted that almost all people are treated non-specifically, like we don't know the cause, so we're just going to use medications. Well, the problem with that is then, because you're not specifically treating the cause, like let's say the cause is a problem with the vagus nerve or the glossopharyngeal nerve from a neck problem, you can specifically treat the neck problem and then the high blood pressure will go away. Well, if you use medications and you're not treating the exact cause, it's fraught with problems. In other words, the therapy will be wrong because it's not addressing the cause. Then basically, because people don't feel good on the medications, like give you an example, a common medication used for high blood pressure is propranolol or beta blockers. Well, beta blockers are known to cause depression, and they cause your body to have an even slower metabolism because they slow the sympathetic system, or they inhibit the sympathetic system, which has to do with energy and vitality and stuff like that. So people then are non-compliant. Well, the problem is then they have high blood pressure because it's not getting treated appropriately, and studies have found that the mortality rate, in other words, what's the average person dying of, it's gone from 25% due to cardiovascular mortality, and now it's up to 40% of mortality in 2020. So in other words, the number one killer still is cardiovascular disease, and a lot of cardiovascular disease, most people believe, is from unresolved high blood pressure. As we've said, 90% of the cause of high blood pressure is typically not known. Hauser's law is when the etiology of symptoms is elusive, following the neurology leads to ligamentous joint instability as the cause. So let's look at the neurology of blood pressure. Now, there's many different organs that are involved in blood pressure. Blood pressure is defined as the pressure the heart has to pump against to get the blood to the feet, but especially up to the brain. And when blood pressure is over 140/90, like it's 160/100, a person's said to have high blood pressure. Now, typically, when you go to the doctor and your blood pressure is a little bit high, they're not supposed to say you have high blood pressure because you're in a doctor's office and it's stressful. So you're supposed to take it at home, and after a few times measuring it, if it's always 140/90, that's considered high blood pressure. And the problem is, if your heart has to keep pumping against such a hard pressure, it eventually is going to damage the heart and can lead to heart disease. And heart disease, or the arteries clogging up in the heart, that can cause a heart attack, and of course that can lead to dying. There's lots of organs involved in how the body regulates blood pressure. Now, when the blood pressure is low, the sympathetic system clamps down on the arteries and blood pressure goes up. So what's supposed to happen when somebody has high blood pressure is the vagus nerve is supposed to calm the body down, and other things happen to lower the blood pressure. A really low blood pressure is an acute problem. You know, it can be life-threatening because the brain's not getting enough blood. But high blood pressure can be acute, like somebody has like they get COVID or they get the flu, and all of a sudden they have a spike in blood pressure, and it can be dangerous where it goes over 200 and you need medications. But typically, high blood pressure is a chronic problem that the person doesn't even know exists, and the reason is because high blood pressure typically doesn't have symptoms, so they don't go see a doctor, and that's why all doctors' offices typically check for high blood pressure. Now, we said Hauser's law is that you got to follow the neurology. So the carotid sinus or carotid bulb, which is in the mid-neck region, is innervated by the glossopharyngeal nerve. When blood pressure is too high, you know, the blood pressure is too high, the sensors in the glossopharyngeal nerves send off signals to the brain stem to start the process of lowering blood pressure. And the vagus nerves innervate the aortic arch, so that's another sensor of what's going on in the blood and the blood pressure. So those are the two main nerves that have to do with sensing blood pressure. Now, if the temperature sensor in this room was off, one day I'd come into this room and the temperature would be too hot, and another time the temperature might be too cold. So you can understand that if the sensors for blood pressure are off, then the person might have high blood pressure one day, low blood pressure the next day. And let's be reminded that the vagus nerve innervates many, many things inside the body. Like, it innervates the spleen, the liver, the kidneys, the stomach, the pancreas, the lungs, the heart. So there's many different avenues by which vagus nerve degeneration might lead to high blood pressure. It's also important to understand that the cervical sympathetic ganglion run right along the spinal cord, and the ones in the neck, like this big one right here, that runs, the superior cervical sympathetic ganglion is right at C2. So any type of ligamentous injury in the neck, especially up high, can lead to a dysregulation of the autonomic nervous system, leading to high blood pressure. And I like this illustration because it shows how the nerves wrap around the arteries. So in other words, if the sympathetic tone increases, the blood vessels clamp down, and if the sympathetic tone decreases, the arteries dilate. So guess what nerve inhibits the sympathetic tone? The vagus nerve. The vagus nerve. So the vagus nerve is intimately involved in the regulation of blood pressure. So in the brainstem, there's a cardio-inhibitory center that can affect the autonomic nerve supply to the heart. So basically, the glossopharyngeal nerve and the vagus nerve, and they're on both sides. The glossopharyngeal nerve is cranial nerve 9, and the vagus nerve is cranial nerve 10. They're going to send signals up into the medulla, the brainstem, which sits right above C1, and it's going to give it input about what to do. So if blood pressure is low, there's going to be sympathetic discharges to stimulate the sympathetic system to clamp down on the blood vessels to raise blood pressure. And if blood pressure is too high, it's going to inhibit the sympathetic tone so the blood vessels dilate. This shows the atlas C1, this is the axis C2. The glossopharyngeal nerve and the vagus nerve run right along the anterior vertebral bodies, and the ganglion of the vagus nerve, especially the nodose ganglion, sits right at C1. So the problem is if you have a forward face down lifestyle and your atlas is too far forward, like say because you got ligament injury in the back of the neck, the atlas is here instead of here, that's going to compress the nodose ganglion. And when the nodose ganglion gets compressed, basically the vagus nerve gets smaller. These are some of the tests that we do in the office here. We actually measure how big the vagus nerve is. And once the vagus nerve is injured, well, the body can lose some of its ability to regulate blood pressure, and the blood pressure can go up. So for blood pressure and other things, there's a balance between the sympathetic system and the parasympathetic system. So I'm going to give you some easy things to do at home, and it'll tell you whether your sympathetic system and parasympathetic system are in balance. If you have light sensitivity, like other people can be outside in the sun and they don't need sunglasses. If you always need sunglasses, it means, and if you look at your pupils compared to other people, you'll see that your pupils are dilated. So a constantly dilated pupil means there's too much sympathetic system, not enough parasympathetic, and the sympathetic system is what raises blood pressure. That's one thing. The second thing is, do you have a good gag reflex? So in the office, I take a tongue blade and I'll poke the back of the throat. What's supposed to happen is when I do that, the person's supposed to gag. Well, there's people that I go bang, 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 and nothing happens, so they have an absent gag reflex. Well, it turns out the sensory branch of the gag reflex is the glossopharyngeal nerve. So in other words, the glossopharyngeal nerve innervates the mucosal surface in the back of the throat, and the vagus nerve is what gives the gag reflex. So if somebody has an absent gag reflex, it means that probably your blood pressure sensors aren't working so good. And again, what's supposed to happen is when you have high blood pressure, so in other words, person has high blood pressure, the glossopharyngeal nerve says to the brainstem, the medulla oblongata, there's high blood pressure. Well, what's supposed to happen is the vagus nerve is supposed to send inputs to slow the heart rate down and eventually cause inhibition of the sympathetic system, and then the arteries dilate and the blood pressure goes down. So obviously if this is injured or this is injured, that's not going to happen, and then the person has high blood pressure. The relationship between blood pressure and heart rate are basically inverted. So this kind of shows that there's an inverse relationship between pulse rate and blood pressure. So when the blood pressure goes down, pulse increases to raise blood pressure. Or saying it another way, when blood pressure goes up, the pulse rate decreases to lower blood pressure. And we all know that when you have a high vagal tone, your vagus nerves are healthy, working good. There's a sense of serenity, peacefulness, and the pulse rate goes down. So the higher the vagal tone, the healthier the vagus nerves are, typically the lower the pulse rate. So if you're somebody who has high blood pressure, your pupils are dilated, you have a negative gag reflex, and your pulse rate's over 80, and you're just sitting there, you probably do have some problem with your vagus nerve and should get it checked out. So I put a reference here, and from this reference, and this was done in 2019, this article. So it says the vagus and glossopharyngeal nerves in two autonomic disorders. The glossopharyngeal and vagus cranial nerves provide the brainstem with sensory inputs from different receptors in the heart, lungs, and vasculature. This afferent or sensory information is critical for the short-term regulation of arterial blood pressure and the buffering of emotional and physical stressors. Lesions that selectively destroy the sensory or afferent fibers of the vagus and or glossopharyngeal nerves can interrupt the transmission of baroreceptors, meaning stretch receptors, signaling, leading to extreme blood pressure fluctuations. And again, this just shows, again, the glossopharyngeal and vagus nerves sit right in front of the atlas and axis. I got some more articles here. So in other words, in animals, there was researchers that showed that if you destroy the nodose ganglion, and again, that's one of the ganglion where the DNA is, the cell bodies of the vagus nerve, which sits right around C1. When you destroy that, you can actually cause injury to the heart, kidneys, intestines, nervous system, and lungs. And it said here in one of the studies, it said that vagal ischemia induced lung infarct and respiratory arrest from pulmonary artery vasospasms. So that was one thing. Then it said degeneration of the vagus kidney branches caused glomerulonephritis, kidney cell death, renal failure. Vagus nerve degeneration caused injury to the intestinal enteric nervous system. The amount of neuron degeneration correlated with coronary artery vasospasm and even the animal death. My point is that injury of the nodose ganglion is very, very serious and can affect blood pressure in many, many different ways. Now, I put this on here because all of us can help our vagal tone by improving our heart rate variability, and I have done videos on heart rate variability. Heart rate variability is associated with lots of disorders, including heart disorders, and they've shown that when your heart rate variability is high, the likelihood of disease goes down, health improves, and heart rate variability is very much correlated to how many breaths you do per minute. So there's watches a person can have, there's monitors that can measure somebody's heart rate variability. And what we recommend with patients is that they get a baseline heart rate variability, and we like their heart rate variability to be over 70. And then they get in a quiet room and then change how many breaths per minute. So heart rate variability is normally maximized by 6 breaths per minute. So that would be like this, and you always breathe through your nose. You know, 5 seconds in, 5 seconds out. And the most important thing is actually slowly breathing out. So you don't realize how fast most of us breathe. Now, how do you determine whether or not you have a structural cause of a high blood pressure? So I told you some things to do at home. In the office here, we do what's called a digital motion x-ray. So we're looking for, is there instability at C1, C2? And if there is instability, which that you could see right here, then the treatment that we do is prolotherapy. So this is Dr. Hemwell. That's the doctor who taught me prolotherapy, and I took over his practice when he retired. He was 85 years old and I was 30 when he first hired me. And that he's in his late 80s there, and he's illustrating at a medical conference prolotherapy. And then this is me in 1992 getting prolotherapy by Gerald Montgomery, and that was the first area I ever had done on my body was prolotherapy to the neck. So there's people that have upper cervical instability, and the upper cervical instability is then causing excessive motion or destructive joint motion at the C1, C2. That can injure the glossopharyngeal nerve or the vagus nerve. Thus, the person's blood pressure sensor's off. And once the blood pressure sensor's off, then of course a person could get high blood pressure. Also, when there's ligament damage in the back of the neck, it can cause a change in a person's cervical curve where it actually blocks the jugular vein. And then if it blocks the jugular vein, then the brain pressure goes up, which is separate to high blood pressure. And once the brain pressure's up, that can affect the cardioinhibitory center of the brain stem, as well as other things that are involved in blood pressure in the brain. So there's multiple mechanisms by which upper cervical instability or ligament damage in the neck can lead to structural high blood pressure. But I'm here to say you absolutely can get it helped by doing curve correction and prolotherapy. And with ever increasing frequency, I am seeing in the office people that are apparently healthy but have high blood pressure. So I'm here to just tell you the prognosis is very good once the structural cause of the high blood pressure is found with appropriate care.